Hi, I'm Jo. I'm a general dental practitioner and I'm just here today to have a brief chat about bone cancer and just to raise awareness from a dentist's point of view. So we can talk briefly, have an introduction. So we'll have a brief introduction and then we'll talk about the symptoms and signs that we need to be looking out for when we're looking for bone cancer in our patients. And then we'll go on to have a brief discussion about the referral pathways that we need to follow and how we can work together with GPs just to give our patients the best chance. And then a little discussion about the training and support that we can help provide for our junior colleagues. Okay, so I'm Jo Wilson. I graduated from Leeds Dental Institute in 1997. I've worked predominantly in NHS practice in Wakefield since 1998. Makes me feel very old. Last year I just became an educational supervisor with a colleague as part of the 2-year longitudinal scheme, which is a fantastic scheme in Yorkshire. The 2 foundation dentists that we support are brilliant. They have a fantastic broad basis of both general dental practice and the hospital service. So as regards cancer diagnosis, they get to see obviously the diagnostic area in general dental practice, general dental practice, and then moving on to the treatment in the hospital service. So it's a fantastic scheme. So I'm just helping a friend today to raise awareness during Bone Cancer Awareness Week for the Bone Cancer Research Trust and all the fabulous people here, the wonderful work that they do. So moving on, we can talk about the symptoms and signs that we see and we may see as our patients walk through the door. Well, our examination should begin from the moment a patient walks through the door. We can be looking out for swelling and facial asymmetry the minute they walk into the surgery. The reception staff and the nursing staff, they know that if a patient attends with a swelling, they need to be seen urgently as a priority, and we will always make time in our diary to deal with these patients, whether they're registered or not. So a patient may present with pain or difficulty swallowing. The swelling may be extraorally, intraorally, it could be along the angle of the jaw, in the neck. So we're looking out for any unusual swelling. We're looking for areas of jaw pain, a history of pain, particularly of any pain that wakes a patient at night is usually severe, whether it's a dental pain, which most people know is horrific. An irreversible pulpitis is incredibly painful, but we also need to be aware of other possibilities for this pain. So as we said before, if a patient walks through with the door with a swelling, that's obvious and we can see that asymmetry. It's something that needs to raise alarm bells as we're part of our examination. We're looking out for unusual tooth mobility. We will all have patients with long-standing periodontal disease and we're aware of these areas of mobility, but in younger patients and unusual areas of tooth mobility should again always raise alarms, and we should be looking out for that. When we're looking for ulceration, that's important as regards head and neck cancer. The lining of the dental mucosa is generally made up of squamous cells, and squamous cell carcinoma is one of the most common cancers of the head and neck. Obviously, cancer of the head and neck can arise also from the salivary glands, the sinuses, the muscles, the nerves, and the bone, you know, which is our topic today. So we need to be aware of these areas of ulceration. For example, sinus tumours may present as an ulcer in the roof of the mouth on the palate. So we need to be mindful of this and looking out for more aggressive tumours in that area. We're looking out for red or white patches in the mouth. Now, these may or may not be red or painful to touch. The patient may not be aware of anything abnormal in the mouth whatsoever. So it's important that we are looking out for these areas. As a part of our extraoral examination, we're looking for lumps in the neck, and we palpate along the mandible and feeling for any cervical lymphadenopathy, any swelling of the nodes around the neck. Another thing to sometimes look for is if a patient presents with an ill-fitting denture. That may be due to a swelling that's appeared in the roof of the mouth or underneath the tongue in the sublingual area. So these are things that we should, if a patient presents with this, we just need to think outside the box and have a look and see if there's anything untoward that may be causing this, other than just a generalized loss of fit over time. We should also be looking for any areas of numbness of the face, the jaw, or the teeth. Because obviously if there's a tumour that's affecting the bone of the mandible, that can also begin to impinge upon the nerve supply of this region also. So some more severe red flags that we need to be looking out for are nocturnal bone pain. That's intense, that can disturb a patient's sleep. And if we're getting to the extreme levels, then we're looking at pathological fractures. And we're always on the lookout for atypical bony or soft tissue swellings, which may or not be painful to the touch. So it's imperative that we have a working knowledge of normal anatomy, and then we always undertake a full extraoral and intraoral examination of hard and soft tissues. If there's anything untoward, then obviously we follow up with special tests like radiographs. There is a limit when we're considering bone cancers as regards the intraoral radiographs, because we're not getting a greater level of detail. We can look for variations in bone density, but generally when we refer, the more detailed imaging will be necessary, such as CT scans or MRI scans, depending upon the clinical findings. If we have an OPG facility in a dental surgery, then something such as an ameloblastoma, which is a non-cancerous, locally aggressive tumour usually in the wisdom tooth area of the mandible, that can show up on an OPG with a soap bubble appearance. So although these are rare, it's important that we still have it in the back of our mind. And if there's anything that's unusual, that we do consider to refer at this point. As regards the primary bone cancers of the skull and the facial bones, we've got, they account for about 10% of primary bone cancers. So if we're looking at such as osteosarcoma and Ewing sarcoma, these tumours do commonly affect children and young adults. So if there's anything unusual in these categories, it's important that we have that possibility of a diagnosis if there's swellings or bony swellings in these areas. Tumours such as chondrosarcoma tend to affect adults over the age of 40. So other such tumours of the mandible generally account for about 4% of primary bone cancers. So although they're a small portion, if there's a chance that we may find one of these, then it's important that we refer, which is our next port of call. So when we're thinking about the patient that we've had in our chair, it's important that we have an open and honest conversation with them at this point, that we've found something we're not entirely sure what it is, and it's important that we do talk about the possibility that we are concerned it may be cancer, because we have a duty of care to our patient to advise them that we are referring on as a fast track during the 2-week fast track path local urgent pathway. It's not an easy thing to do. Patients, understandably, the minute they hear the word cancer, it fills you with fear. But it's important that they know that this isn't our area of expertise, and at this point we found something, we're not entirely sure what it is, but we feel the need to refer to somebody who is an expert, we're referring for advice and treatment as necessary. So as regards dental referrals, we refer via the ERMS website. All of our dental surgeries have our own login and password to get through to this, and it's really straightforward. I'm a technical dinosaur, so if I can do it, anybody can. So as regards other healthcare professionals in primary care, they refer via the NHS e-referral service. It's vital that we all keep contemporaneous notes and record the referral reference in the clinical notes. It's imperative that we're not worrying about over-referring and that we trust our gut. If something doesn't feel right, generally it isn't. So we shouldn't have a fear of over-referring, but if there's something that doesn't fit our normal diagnostic pathway, that we take it to the next level. Bone cancers are very rare, but early diagnosis and treatment is vital. Okay, so if we move on and talk about how we can work with GPs, because often when a patient has an unusual lesion, they don't know what to do and who to see. Sometimes it can be normal anatomy and something that they've noticed, and they've never noticed that they have a lump underneath their tongue before. Whereas obviously as general dental practitioners, we're seeing our patients fortunately on a regular basis, so we have a working knowledge of their normal anatomy. So a lot of patients will attend their GPs as a first port of call, and it's important that if a GP is unsure, then they feel comfortable to contact us if needs be, and that we can work together. We're always happy to have a phone call or for the GP to encourage the patient to book with ourselves for an urgent assessment. As long as the patients inform reception staff that that's what we need, then we'll always see these patients as a priority. And the GPs, if they have any sort of awareness of any of the red flags, then they can refer along the same pathway that we've discussed. They'll have a working knowledge of normal anatomy, but often a patient will just present as a one-off in this instance, and they're not certain who to see first. But for all of us, it's important that we listen to our gut instinct, and if there's any doubt, to go along that fast-track referral process. So now we're thinking about our younger colleagues and how to help them. Obviously the foundation dentists, they've had quite a difficult start to their career at the moment because of the pandemic. So it's vital that we all support each other across the board. We positively encourage open discussion and have an open door policy. At any point, if there's anything we're unsure of, just to ask for help, and another pair of eyes is always useful. 24 years in dentistry, and I will still ask for advice or help, because every case is different and every patient is different, and we should always be mindful of that. There's excellent support for the foundation dentists via the educational supervisors and the training programs across the UK. The training program directors are incredibly supportive. We all have WhatsApp groups to support each other, and if there's anything we're unsure of, there's always a mine of information. online. We have support groups on Facebook, on WhatsApp, and as long as we're adhering to the patient confidentiality and GDPR, there's a lot of help out there for everybody. There's always continuing professional development available online. So through the local deanery, the Max course online in Yorkshire is fantastic. There are always a wide range of courses for head and neck cancer, and online through companies such as Isopharm and ProDental. There are various free webinars that are available, which is important. It's important that we keep refreshing our mind, and this has been a fantastically useful exercise for myself to refresh my memory about the different types of head and neck cancers and bone cancers that may present. And you know, whenever I watch a webinar, it helps, you know, reinforce the need to keep learning, basically, and refresh our minds, because there's a person at the end of the day that we want to help, and early diagnosis and early treatment is imperative, particularly with something such as bone cancer in the head and neck region, because it has lasting implications for the rest of their lives. So I hope it's been helpful today. If there are any questions whatsoever, the lovely people at the Bone Cancer Research Trust are always here for any questions, and if I can help in any way at all, then please feel free to ask. Thank you very much for listening, and take care.